Lymphedema is a condition that affects millions of individuals around the world. The best way to treat and manage lymphedema is with complete decongestive therapy, or CDT. My name is Kelly. I am a physical therapist specializing in oncology, rehab, and lymphedema. And in this video, I'm going to explain what CDT is for leg lymphedema to reduce swelling. Before we begin, make sure you subscribe down below for weekly new videos. You can join us on Instagram for more related content, and you can check out my website for more resources. The current gold standard treatment for lymphedema is complete decongestive therapy, or CDT. CDT is made up of 2 phases of treatment, and it's important for someone to go through both phases for optimal results. So we're going to briefly talk about each of these treatments. But if you want more, you can learn in-depth treatment about the best ways to treat leg lymphedema in my lower body lymphedema rehab program. This program goes highly in depth on the best ways to treat and reduce that lower body lymphedema. It includes visual demonstrations of each component of treatment, including bonus options and detailed videos with easy to follow handouts and more resources, all organized and combined into one program. It's everything that I use to treat my patients in the clinic, but packaged for someone to move through at their own pace. You can learn more about this program or others on my website, which I will link up above as well as in the description box down below. But let's talk about treatment in each of these phases. The first phase of CDT is the reduction phase. It ranges from 2 to 5 sessions of therapy a week and averages 3 to 4 weeks in duration. This phase aims to reduce the volume and decrease the leg swelling while softening any thickened tissue called fibrosis. This phase is likely to include the following: manual lymphatic drainage. Manual lymphatic drainage uses a gentle massage technique, and the goal of this treatment is to move the lymphatic fluid out of that leg and back towards the heart. So a therapist does this technique in a specific sequence to stimulate the lymph nodes and then move the lymph fluid through the lymphatic vessels. The therapist may also spend time with semi-firmer techniques to soften any fibrosis or that hardened, thickened tissue that is caused by chronic edema and inflammation to improve that lymphatic flow. Compression bandaging is also a type of treatment option. So short stretch bandages are used, and they are a very specific type of bandage that are meant for reducing fluid. These are different from an ACE bandage that one may find at a drugstore, as those are considered long stretch bandages and are more likely to cause a tourniquet or skin issues, which I especially see around the ankle area when they're used. And you also want to use various foams and paddings under the short stretch bandages for skin safety and to add layers for more effective compression and reduction. We may also add in special products like Mediven or channel complex foam to help with this process. Or we may add in a swell spot. This is an example one for a foot. It has chipped foam inside, and this is one actually for a thigh. And that goes underneath the bandages as well to create more support. Exercises that are specific to lymphedema can encourage lymphatic fluid flow in the natural direction for decongestion of swelling. I do have a handout on my website for exercises for leg swelling and lymphedema that someone can check out, which I'll link up above as well as down below. But the goal is to find healthy ways to move and activate the muscles, which assist in pumping the lymphatic fluid in the body. So if someone has a sedentary or desk job, then getting up and moving routinely is extra important due to how the fluid can build up lower in the legs and the feet by the end of the day with gravity. If someone is unable to get up and move around easily, then even doing exercises that are laying down or sitting, ankle pumps, pumping the ankles up and down, moving the knees, marching in place, they can all be really beneficial as well. Another component is skincare. So keeping the skin and the tissue healthy can help prevent infections and maintain strong skin integrity. By doing that, we can help avoid skin breakdown or wounds. Lymphedema may increase the risk for infection, and the quickest way to obtain an infection is through an opening in the skin. So this makes skincare an essential piece of lymphedema therapy for the legs. The CDT will be different for each person and should be tailored to each person's individual and medical needs. Additional types of treatment may be included to assist in reducing the volume of the limb or the body area. Once the volumes and the measures reduce and reach a plateau, then we know it's time to transition from phase 1 to phase 2 of CDT. The second phase of CDT is the maintenance phase. This phase starts at the end of phase 1 and continues long term. The goal of this phase is to maintain the reduced volumes that we obtained in phase 1 with a focus now on self-management. This phase may include the following. Self-manual lymphatic drainage, or self-MLD, uses the same gentle massage technique to stimulate the lymph nodes and move lymph fluid through the lymphatic vessels, and this is encouraged to be done daily. I have a handout with step-by-step instructions on how to do this on my website, as well as other videos on my channel, but I will link the handout up above as well as down below. Compression garments. Although using compression bandages are an option long term, they are bulky, especially with all of the paddings, and can be more cumbersome to take on and off. So compression garments or stockings are a fantastic option for long-term use to manage swelling in the legs. Compression garments are maintenance garments as they are used to help contain fluid from building up. There are both garments for daytime use as well as options for nighttime. The patient will be encouraged to continue with the exercises that were taught in phase 1 and will also want to continue to find different kinds or types of activities that are enjoyable and that they can be consistent with over time. Routine exercise is essential not only for lymphedema, but also for overall health to keep muscles pumping, which helps encourage lymphatic flow. Self-skin checks should be done daily or multiple times weekly to look for scratches, cuts, or openings. If any are found, then it's important to care for these to lower the risk of infection. If any new skin or tissue changes are found, along with any signs or symptoms of infection, then it's crucial to seek medical attention right away. Other options for phase 2 treatment for leg lymphedema may include pneumatic compression devices or pumps, kinesiology tape, deep breathing, weight management, nutrition, and more. If someone wants to learn more about these, I do speak more in depth on these further in my lower body lymphedema rehab program, again, that you can check out on my website, which I link down below. The second phase of CDT will also vary for each person and will change and evolve based on changes in one's condition. It's common to periodically return to phase 1 for tune-ups or flare-ups of swelling for optimal long-term management. So these are the main components of leg lymphedema treatment. Be sure to check out the programs on my website for more in-depth support and resources. Treatment isn't a one-size-fits-all, and it's important to test out each of these to find what works best for you. Again, a certified lymphedema therapist will be able to help determine which may be best. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.